Good morning. Today we're going to be talking about HIV/AIDS. We're going to go over a couple of objectives today. Number one, as to what is HIV and how can you get it? How has the disease been understood? Has there been any change in the way that the disease has been defined? How has the disease been understood and viewed by society? And finally, how has the disease been treated by the medical community? Now, what is HIV/AIDS? HIV is a retrovirus, which means that the virus uses RNA as its genetic material and is able to integrate itself within its host. And it's also able to make multiple copies of itself. To contract HIV, the virus must enter the bloodstream and is often transmitted through bodily fluids such as blood, semen, vaginal fluids, and breast milk. Once in the bloodstream, HIV targets a variety of cells, but it mainly targets our CD4 cells, aka our T helper cells. These cells play an essential role in our immune system and fighting off infections. T cells tailor to the body's immune response to specific pathogens. There are the soldiers that annihilate the invaders. The element HIV is covered in glycoproteins that mutate frequently. This ultimately tricks the T cell receptors to not recognize the virus. Once attached to specific proteins on the cell, it begins to fuse the membranes together. Because HIV is a retrovirus, it is able to integrate itself with its host DNA. The DNA is then integrated into the host's genome and makes T helper cell treat viral genes as if they were their own. This causes them to make more copies of the virus. They leave the host cell mature and then wreak more havoc on other T cells. HIV is difficult to treat as its mutation rate is so high. Overall, this process creates over 10 billion viruses a day. During the initial stages of replication, a person will not show any symptoms for up to 10 years. If not treated, HIV eventually kills off T cells and infects. The immune system becomes suppressed and is more susceptible to diseases and opportunistic infection, such as cancers like Kaposi sarcoma or lung infection like pneumonia. You do not die essentially from HIV/AIDS, just the disease your body cannot. How has this disease been understood? What have people thought caused the disease? How did they come to that conclusion? And how has that changed or not changed over time? Now, the earliest known case of infection with HIV in a human was detected in the early blood sample collected in 1959 from a man in the Democratic Republic of Congo. Scientists identified a type of chimpanzee in West Africa as the source of HIV infection in humans, and they believe that the chimpanzee version of the immunodeficiency virus was called simian immunodeficiency virus, or SIV, and most likely was transmitted to humans and mutated into HIV when humans hunted these chimpanzees for meat and came into contact with their infected blood. Over decades, the virus slowly spread across Africa and later to other parts of the world. It remained in isolated rural communities until major migrations happened to metropolitan areas. This standpoint has not really changed, and scientists still believe that HIV/AIDS is a zoonotic form of disease with origin from chimps and mutated into humans. Has there been any change in the way that the disease has been defined? There have been different symptoms attributed to this disease, known as GRID. Um, There were cases in Southern California that suggested that the cause of immunodeficiency virus was sexual, and the syndrome initially was called gay-related immunodeficiency, or GRID. Later that month, the disease was reported in hemophiliacs and Haitians, leading many to believe that it originated in Haiti. And then the CDC later identified a Haitian nationality as being an at-risk group of AIDS. The CDC used the term AIDS for the first time, describing it as a disease at least moderately predictive of a defect in cell mediated immunity occurring in a person with no known case for diminished resistance to that disease. Later in 1983, AIDS was reported amongst female partners who had the disease, suggesting that it could be passed via heterosexual sex. The first reports of AIDS in children was hinted um, to be caused by um, mothers giving birth to their breastfeeding their kid. They obtain HIV within that contact form. In 1984, research groups led by Dr. Gatto and the French professor Dr. Guy and Dr. J. Levy from University of California, San Francisco, and they all identified and discovered a retrovirus was the cause of AIDS. And later on, that same retrovirus was later renamed to human immunodeficiency virus, or HIV. Now, HIV does not have any symptoms, and it will continue to not have any symptoms. That has not changed. But symptoms that we have come by over the years, usually within 2 to 4 weeks after infection of HIV, you usually get around flu-like symptoms. It's like just the body's natural response to any infection. So you will receive fever, chills, rash, night sweats, muscle aches, sore throat, fatigue, swollen lymph nodes, mouth ulcers, and these symptoms can last anywhere from a few days to several weeks. But some people haven't reported any symptoms, actually many. Now, after stage 1 of that acute infection, there's clinical latency, and usually, again, there's no symptoms of this, but the HIV pretty much works silently. The virus multiplies at very low levels, and people won't feel sick at all. And then finally, as the disease progresses and you lose CD4 cells and your viral load is through the roof, you go on to stage 3, which is AIDS. And if you have HIV and you don't get HIV treatment, you will eventually get to this stage, this very late stage in the disease. Symptoms of AIDS can include rapid weight loss, recurring fever or profuse night sweats, extreme and unexplained tiredness, prolonged swelling of your lymph glands, armpits, groin, and neck. That's where you're going to be swelling. Diarrhea that lasts for more than a week, sores of the mouth, anus, or genitals, pneumonia, red, brown, pink, or purplish blotches, or corpososarcoma, memory loss, depression, and other neurological disorders. Each of these symptoms can be related to other illnesses, but this is what symptoms you would experience if you have AIDS. Now, how has the disease been understood or viewed within society, and how has that changed over time? Now, this 4-H club was developed in the 80s, and this 4-H club has caused a lot of stigma in societal norms. So the 4-H club was for the likelihood of getting AIDS, and that included homosexuality amongst males, hemophilia, heroin use, drug use, that's pretty much involved within sharing needles, and Haitian origin. That was the 4-H's, and those 4-H's caused a lot of stigma towards those groups or people that happen to identify with any of those groups. Ryan White was one of them. That's pretty much the face of HIV. Ryan White received an HIV-infected blood product and was later diagnosed with AIDS. And when he tried to return to school, he fought public ignorance and AIDS-related discrimination in his Indiana community. He was given 6 months to live, but he ended up living 6 years. And he was later regarded as a champion and became the national face for HIV/AIDS. So that was a particular example of how it affected hemophiliacs. For over a year and a half, from 1991 to 1993, the United States government ran a special detention camp, Camp Bulkley, at its naval base in Guantanamo Bay, Cuba. In a sense, it was a camp that represented another episode in the denial of refugee rights. and it contained 310 Haitian men, women, and children, and they were prisoners to two of the world's first and only detention camps for people with HIV. Um, Member of Parliament, Lord Russell, um, I put his quotes there because he was battling HIV himself, and he had words to say that really pretty much defines the societal standpoint of HIV and the stigma. How HIV had kept him from speaking about his status for fear of spreading, and what used to be a deadly disease, and the fear that people may reject him if they knew he was living with HIV. Overall, what he quoted was that stigma is what makes HIV/AIDS life threatening. All the stigma makes a treatable disease life threatening due to the impact on an individual's mental health and access to medication. And in no way should we glorify HIV, but it's livable and it's manageable. And living with HIV should not hold anyone back in any way, shape, or form. So these are sort of examples of what people dealt with for stigma. There was a lot of stigma surrounding HIV for different groups of people, and even to this day, there is a lot of stigma surrounding it, but not the hysteria that we faced in the 80s. Now, how has the disease been treated by the medical community, and what treatments have doctors prescribed that has changed in any way over time? Now, if we're talking about the medical community or just our healthcare community, healthcare providers' stigma towards patients with HIV is holding back HIV prevention goals. This was just a study conducted by the U.S. Center of Disease Control. Providers and those who work with HIV or people have sexually transmitted diseases were significantly more likely to hold stigmatizing attitudes towards people living with HIV. Doctors can refuse to enter into a contract with any given patient for whatever reason, just as other professionals have this right, and many HIV patients that need a particular medical procedure done can be refused by a doctor. So currently are a lot of HIV patients that will approach doctors for help in a particular or just a particular procedure, and the doctor will refuse them because they have that disease. Stigma can be manifested through inadvertent behaviors and ideologies such as homophobia, transphobia, racism, and negative views of persons who inject drugs, and can create uncomfortable environments and act as a barrier to prevention. Now, one thing that is pretty much a preventative measure, we're going to just talk about preventative measures first before we talk about the actual treatment. One preventative measure would be condoms. Condoms. They prevent HIV and a majority of STDs as well, as long as they are used properly. And then we have pre-exposure prophylaxis and post-exposure prophylaxis. Pre-exposure is only for people who are ongoing high risk of HIV infection. It's also known as PrEP. PrEP tends to focus on reverse or just the reverse transcriptase. It's basically a reverse transcriptase inhibitor, and so it prevents HIV from transcribing into your DNA. And then we have PEP, post-exposure prophylaxis, which is only for just recent exposure to HIV, so your last-minute resort. And this is an integrase inhibitor that targets HIV from inserting itself into the human genome. So those are preventative measures for HIV, pretty effective preventative measures. You just go to the doctor and get a shot of some pills. Now, if you happen to be an individual that has been exposed to HIV or has obtained HIV, we do have treatment for it. We have Daraprim, even though it's $750 a pill instead of the $1350 it usually started out with. Daraprim is still a effective drug that is used to treat any serious parasites of the body or to prevent toxoplasmosis infection in people with HIV infection. Now we also have HART therapy or ART therapy. if you have HIV, and that stands for Antiretroviral Therapy. Now, antiretroviral therapy, this is a combination of medication that a physician prescribes to you based on pretty much your viral load, the strain of HIV, the CD4 count, and other things such as disease symptoms. We also have vaccines, even though there are no vaccines for HIV, they're pretty useful in helping with symptoms of HIV. Otherwise, stay safe out there. This is pretty much concludes my presentation. I hope you all have a nice rest of your day. Goodbye.